Thank you for staying with your world on NTV this morning. It's time to shift gears a bit and talk about affairs of the heart, but not affairs of the heart in matters love, but actually affairs of the health of your heart, because it's World Heart Day today, a day set aside to on the 29th of September every year to celebrate and spread awareness about the importance of keeping your heart fit. And it's one of the important organs in your body. This morning, we'd like to highlight the issue of the heart diseases, the burden of heart diseases in Kenya, and what can be done to reduce the burden in the country. I have a very interesting panel who would help us, of course, address this conversation this morning. Joining me in studio this morning, Michael Odror is the franchise head at the Cardiorenal and Metabolic Franchise East Africa at Novartis. Good morning, Michael, and welcome to the show.
Good morning.
All right.
Good morning, viewers.
All right. Good to see you. Joining us in studio as well this morning is Dr. Daniel Ndwiga. He's a board-certified physician, cardiologist, and electrophysiologist. Get that correct. Electrophysiologist. I'll want to know much more about this very important title as well. This morning, joining us virtually is Dr. Elizabeth Onyango. You know her. She's a friend of this show, a public health specialist and head of the Division of NCD Prevention, that is Non-Communicable Diseases Prevention and Control at the Ministry of Health. And we'll also be joined shortly by Dr. Lois Wagana. She is a physician and cardiologist based in Nyeri. Good people. Let's begin this conversation, and maybe we can start. It's the 29th of September, the World Heart Day. For anyone who cares and doesn't know the importance of this day, Dr. Ndwiga.
Thank you so much, and thank you for the opportunity to sit here with you and participate.
Yeah.
Today is the 29th of September, which has been designated by the World Health Organization,
yeah,
and the World Heart Federation as the World Heart Day. The theme for this year is use your heart to connect. Yeah, or use love to connect.
Okay.
And we are encouraging Kenyans of all walks of life to think about their hearts today, consider the risk factors for heart disease, take the necessary measures that are there to actually keep yourself healthy.
Okay.
Because our hearts beat every minute for about 72 beats per minute, times 24 hours a day, times 365, times as many years as you're going to live, 70 and more. So it's one of the most vital organs we must keep healthy and strong so we can enjoy our lives.
Okay. That's good, because sometimes when we talk about affairs of the heart, we try to remind people that the heart actually has other functions other than loving. Let's get to the burden, because according to the World Health Organization, I believe the statistics are from as 2019, 79 people were estimated to die from cardiovascular diseases every year, representing 31% of deaths worldwide. That I think is a very huge figure. Maybe we can get Dr. Elizabeth Onyango to talk to us for Kenya. How's the situation, the burden of heart diseases in Kenya like in 2021?
Thank you, Victor, for allowing us to be in the show.
Yeah.
And when we talk about the burden of cardiovascular disease, globally, it is rising, and it is the leading cause of death in the world. In 80% of these cardiovascular-related diseases in the world occur in low and middle-income countries like Kenya. So in Kenya, CVDs are, or rather what we call cardiovascular diseases. Sorry if I use CVDs, that is our abbreviations. It's estimated to contribute to 25% of all hospital admissions. So in other words, 1 out of every 4 people admitted in our hospital is suffering from a cardiovascular disease or a heart disease. Hypertension or high blood pressure is the commonest risk factor for development of most of these heart conditions. Okay. And in our country, actually 24% of adults in Kenya have hypertension. Okay. The sad news is that only 22% of these people with hypertension are actually on treatment. And again, only 4% have their hypertension that is under control. So this is causing a lot of burden to the country. There's a lot of out-of-pocket spending towards heart conditions.
Okay.
Over.
All right.
Yes, but we also have to understand that unless we control the hypertension and the heart diseases, then we risk having complications like heart attack, stroke, kidney failure, and even blindness. Over.
All right, so the risk is clearly clear, but in 2021, if you look at those numbers for Kenya, you said 1 in 4 people is going to hospital because of this issue. Would you say the numbers have been worsening or improving in the, let's say, in the last 5 years?
What we are seeing is an increasing number of mortalities, actually deaths, due to these non-communicable diseases, especially the cardiovascular diseases. And unless we do something, then we are facing another pandemic, just like the COVID pandemic.
Okay.
The number is increasing, yes.
Okay. Maybe Dr. Ndwiga, before I go to, I mean, why are we seeing these numbers rising at this point?
I would say a good thing is that you're picking them up more.
Yeah.
Case in point is the rural areas. We're getting more and more patients coming in with the diagnosis of heart failure. The index of suspicion is increasing at levels as low as the dispensaries. We've been very successful at the control of HIV/AIDS. The healthcare providers in the very basic primary levels of care are able to take a blood pressure and they're able to pick up the fact that it's uncontrolled. They're able to take a sugar and able to say this is actually uncontrolled sugar. And those are the key main drivers for heart disease in this country. Okay. We do have another peak that's happening with the young guys because of something known as rheumatic valvular disease. Okay. But the main concern we have actually is more to do with, like Dr. Ria said, non-communicable diseases, diabetes, hypertension, driving heart disease. Okay.
And definitely I want to come back to the issue about young people, but really, Michael, part of the problem and the reason we are still here today, and this has been proven in so many ways before, is we still have a challenge of inadequate healthcare infrastructure for testing these things and treating them, and also the issue of enough doctors, enough expertise, especially in the rural areas, to be able to help people manage their lifestyles. Kenya was one of those countries to benefit from this Novartis Access program, I think in 2015. It's been 6 years. Talk to us about what the work that you've been doing over the last 6 years with regards to CVDs, as Dr. Onyango would call it.
Yeah, thank you. Now, let me pick up from where Dr. Onyango left. Yeah. You know, Dr. mentioned that 1 in 4 out of 4 beds in hospitals is occupied by a cardiovascular disease patient. Now, that is quite a heavy burden, especially in our part of the world, where we are not as advanced compared to the western part of the world, for example. So as Novartis, as you mentioned in 2015, we rolled out an access program. And part of that access program was to look into the issue of affordability. Because one of the reasons why we have issues with access to healthcare is affordability. Not so many people, and especially where we don't have universal health coverage. I am very happy that the government has been talking about that, because then you have many patients buying from their pocket, and the affordability is not good. So part of it was to be able to address the issue of affordability. So we availed a number of treatments in the space of heart failure, hypertension, and even diabetes at a fairly affordable rate. We are looking at not more than $1 a day, irrespective of what combination you have. But beyond that, there's also the aspect of broadening access. We know that a number of our population in Kenya and many other sub-Saharan African countries live in the rural areas. And for them to be able to access healthcare, before you even talk about the cost of medication and cost of consultation, there is also the movement from where they are to come and seek healthcare in the urban areas. So 2 ways to look at it. Either you keep moving them to the urban areas to get the health service that they need, or maybe you could consider moving the service closer to them. One of the ways you do that is to try and to upskill, to train more hands, because we have very, very few cardiologists like Dr. Ndwiga here. We have very few of them, and most of them are in the urban areas. Unless we are able to build capacity by training more hands who can do diagnosis, can do screening, so that this money that our people are using to travel from where they are to come and seek healthcare, that money can be used to buy medicine, to pay for consultation. So we are also investing quite a bit in upskilling, of course in partnership with our partners like Kenya Cardiac Society and the government.
Okay. At that point, that program was actually a game changer. I'd be very interested to know how far it's progressed 6 years on here.
Yeah, so, I mean, from the time of 2015 when this program was launched,
yeah.
I mean, at the time we didn't even have accurate data in terms of how many patients are we able to reach. And it could not have been up to 500,000 patients in Kenya for Novartis. It would interest you to note that a few years down the line, in 2021, we are looking at reaching more than 3 million patients from Novartis alone. I haven't talked about the other pharmaceutical companies. So from Novartis alone. And a lot of these patients have been reached from this access arm of Novartis. It's not from our innovative medicines part, which is fairly costly.
Yeah.
So the access part I've been able to reach, I would say, this year, we'll be talking about more than 2 million patients between 2015 and 2021.
Okay. And I like that you bring up the issue of cost here, Dr. Ndwiga, because clearly, I mean, at this point, we're still struggling with how much is covered within by the National Hospital Insurance Fund. And I think the information that I have is it's not part of the package.
Yes, unfortunately, diagnosis where the heart is concerned is really not part of the package that NHIF offers. However, having said that, if you do go to a public facility or a mission-based facility, this would be consultation and a basic test called the ECG or the EKG, and sometimes a test called the echo might be covered. I'm saying might because these tests are not easily available in many of the public facilities. The level 5 facilities in this country now are able to do echo. ECG facilities are available in most district hospitals. When you go down to the sub-district and the level 3s, the level 2s is not available. So that you find that only the ones able to travel to these major cities, to these major facilities, the level 5 hospitals, the level 4 and level 5 hospitals will be availed these facilities. Secondly, the skill and the training to actually be able to perform these tests. Because I have conducted over the years an ECG training program, and you find that nurses, primarily nurses, because they form the larger bulk of the hands of the medical healthcare system, actually not able to perform a 12-lead ECG. You find that it's specialized nurses within specialized units like the ICU are able to do this. So there's a lot of knowledge, a lot of skill that needs to be imparted, not just in the private hospitals, but also in the public hospitals. So even where the facilities are available, there may not be the expertise to be able to use them. Having said that, we are not where we were even 2 or 3 years ago. The facilities are more available in private facilities throughout the country, and there is a price to pay, so that's something that I hardly need to overcome. But that's why I said that our index of suspicion and ability to diagnose has actually improved with the years.
Okay. Let me take you back then to where actually we should have started. So for anyone who is watching this morning, how do I know that I might actually be suffering from anything that might not be very well with my heart?
Primarily, we talk about your ability to perform activities of daily living. We talk about your ability to be able to take 10 steps without stopping or panting. We talk about your ability to be able to climb at least 1 flight of stairs. We talk about whether or not you're sleeping. So it's about breath. It's about your energy and tolerance to exercise. It's about your ability to sleep. Now, looking at your own body, you talk about, are you swelling in the legs? If your legs are swelling, it's a warning light that maybe there's something wrong, either the kidneys or with your heart. If you're over the age of 65 or over the age of 40 and have high blood pressure, it means that the risk of heart disease is actually significant with you. If you are diabetic, or if your weight is over the weight of 90 kilograms and your height is not more than 5.5, you're already in the obese range and you're in danger of heart disease. If you smoke and have smoked for over 5 years, and if you take alcohol more than 3 beers or so over a 5-year period of time, you're also at risk of getting heart disease. So if any of these statements I've mentioned applies to you, it's time to make sure that your heart is checked. Get a blood pressure done, get a sugar checked, and get someone to do a 12-lead EKG on you, and if you can, access yourself to a cardiologist. Okay,
but I mean, the concern that most people have is, and it will come to the issue of prevention later on, is always how do I mean, what is causing this? What are the things that predispose me or put me at a higher risk of suffering from those things?
I think Dr. Nyango started us off well by mentioning the risk factors for heart disease. And if I could go through them again, there are some, we call them non-modifiable. This is to do with your gender, your age, your race. So that we know certain ages above the age of 65, certain genders, the men, races, talk about blacks primarily, but also the whites and the Asians. There's different sort of predisposition to these diseases. We talk about your level of activity, sedentary lifestyles, which is what unfortunately we've been so used to in the urban areas. We get into cars everywhere we go, and we sit in offices the whole day. We hardly walk. We don't use our feet much. We talk about high blood pressure. Anybody with a pressure that is above 140/90 over a sustained period of time, more than 2 readings above 140/90, or on medication for blood pressure, that puts you at risk of high blood heart disease. Anybody with sugars that are above 11.1 on a random scale, or we have another test we call the HbA1c, above 7.5%. These are technical terms, but I'm just putting them out there for the people to actually know how they can assess themselves. So we're talking about blood pressure, sugar, being overweight, alcohol, excessive alcohol, and smoking of all kinds. That puts you at great risk of developing these diseases. For our younger population, we do have, I mentioned earlier, rheumatic heart disease, which is a consequence of poorly treated, untreated, or inadequately treated sore throats of a particular kind of bacteria that ends up affecting the valves of the heart. And then with time, these valves actually get damaged, and the children develop heart disease.
Okay. Allow me to go back to Dr. Onyango on this, because clearly 1 in 4 people, you've mentioned that the burden is clearly increasing, and we are even much more concerned that it is growing in people who are in a very young age, in their 20s, in their early 30s. The government is part of those who are actually leading the war. Talk to us about perhaps the strategies that we are putting in place at this moment to try and see that we can perhaps start to win or reduce this growing burden for heart diseases in the country.
Okay, thank you, Victor, once again. So we've recognized that the burden of these heart diseases and other non-communicable diseases are increasing. And as such, the Ministry of Health and the government, we have realigned our policies to address the rising burden. One way of doing that is to bring all players on board through intersector and multi-sector coordination, because we believe that these people are doing something everywhere. But how do we coordinate all these efforts so that we provide services and address the issue in a harmonized manner? So for that, the Ministry of Health, in its policies and strategic plans, we have prioritized non-communicable diseases and heart diseases. We already have the national ICC, what we call the Intersectoral Coordination Committee, that has participation and representatives from all sectors that are there to address the rising NCDs. We have people from the academia, we have the professional bodies like the Kenya Cardiac Society, we have the private sector on board, the county government and the national government, and even the patient groups, the people who are living with the conditions, so that everyone will have their voice and input in the policies that we come up with. Also, another strategy is to try and reduce the modifiable risk factors by coming up with policies and legislations that will promote healthy living. We have the Tobacco Control Act, and that is actually a step in the right direction. We have the Alcoholic Drinks Control Act, not popular with people, but it is good for our health, and the other policies that we will be coming up with that need to be enacted and support healthy living for our people. And of course, not forgetting the service delivery. And Dr. has said, we want that our services be accessible to our people so that we are able to provide services relating to heart diseases, even at the dispensary level, at the health center level, not only the high-level facilities. And we are ensuring that we incorporate the interventions of heart diseases in our primary healthcare packages. Service delivery is done at the county levels. And so we are also partnering with the county to ensure that they prioritize provision of these services that are acceptable and affordable to our clients, and include them in their plans. There's a lot that we are doing, but I've just mentioned 3. We can highlight more. if there is time.
Okay. All right. Let me come back to you, Michael, because she has really raised a valid point on the need for partnerships. And this, and when I think about Novartis, I can't help but remember the issue that we've spoken about, the issue of shortage of professionals and the capacity building that is needed.
Okay. Thank you very much. Now, to add on to what Dr. Nyango just said, from Novartis side, we also did appreciate way back before 2015 that we can't do whatever we need, whatever needs to be done on our own. And so we really much appreciate the partnerships. And over time, we have had a number of programs that we have run in partnership with the Ministry of Health and also with professional associations such as Kenya Cardiac Society. And just to highlight a few of them, in the area of broadening access, we started a training program in the year 2018. That is when we were launching our innovative treatment in the space of heart failure. We quickly realized that there was a gap in terms of diagnosis and the skill to diagnose. As at that time, if I can just give you some figures, we had only about 20 doctors that had the capacity to perform echo. Dr. Ndwiga was talking about echocardiography. Yes. We had just about 20, and the 20 were cardiologists, which basically meant that they were in the urban areas. And we were definitely not going to be able to move. You can't get to treatment until you diagnose. So we quickly, in consultation with Kenya Cardiac Society and the University of Nairobi, and there's another institution in Nairobi called the Heart Center, we developed a curriculum to be able to train some more hands in terms of performing echocardiography and also be able to read it and interpret it. Now, a few years down the line, as we are talking now 2021, we have about 120 doctors. Some of them are doctors, others are clinical officers, we have nurses, we have radiographers. About 120 and counting that can now perform this diagnostic. Beyond that, last year, Novartis donated some 30, what we call butterfly IQ. This is a handheld device that you can carry with you. You just need to connect it to your phone. You carry it with it as a probe, and then you connect it to a phone. And you can actually do echo wherever you are, as long as you can charge your phone and be able to charge the device. It's a very innovative device. In fact, we were the first ones to avail it here. And we have to thank the government because we did get a waiver from the authorities to bring it here. And now we have 30 of them that we have donated through the Heart Center. And this has a capacity to perform 1,200 diagnostics in a month.
1,200?
1,200 diagnostics in a month.
And the mobility aspect means we can bring it to you.
Yes, and most of these doctors that have the gadgets are out there. They're not in Nairobi, because in Nairobi we have the facilities. The government have provided the facilities. Okay. The thing is that the echo device, the traditional one, is a big thing. Yeah. You can't move around with it. It has to be domiciled in a hospital. So the patients have to come to the hospital. Yeah. But with the new gadget that we were able to donate, now we have these facilities available in the counties. Okay. And it's just a matter of time before we add some more.
Okay. And speaking about patients, we actually spoke to one of them. But before we get to hear her story, one of the other factors that have actually played out very well and affected so many aspects of our lives, including the health sector for the last 1 year, is the COVID-19 issue. Allow me to bring in Dr. Lois Wagana. She's from the Kenya Cardiac Society, to just briefly comment on the impact of COVID before we get to hear from, of course, that patient that we spoke to, Dr. Magana. Please give us your thoughts.
Thank you very much, for the program. COVID-19, as you correctly said, has affected most of our lives. When we look at heart disease specifically, we have seen a surge in heart disease in terms of heart failure, where the pumping effect or the pump function of the heart is impaired because of a direct effect of the COVID virus on the heart. We also have issues like heart attacks, which are increasing in number because the COVID virus affects the blood vessels that supply the heart. So sometimes you get the vessels narrowing or we get blood flow obstructed completely, so we get heart attack. It also complicates life after COVID. Some people will recover from the lung disease that makes them require oxygen, but the muscles of the heart are lost even subsequent to the COVID infection. So what we call the post-COVID, the long-term COVID disease, where the patients develop heart failure or they get swelling of the body, weakness, fatigue that goes on for months and months.
All right. Thank you. And before then I let you go, what's the relationship between COVID-19 and someone with a heart disease?
People with heart disease generally have lower immunity than people who do not have heart disease or do not have other illnesses. It is considered as one of the chronic illnesses. So with a low immunity, people with heart disease are prone to much more severe attacks of COVID infection. So we get more severe COVID disease, more severe sickness, or what we call debilitation after COVID recovery, and a more difficult either in-hospital course or a course of illness after that. So these are people that we consider to be prone to this kind of illness. And it's not just COVID alone. People with heart disease are prone to severe infections with viruses like flu, what we call influenza, and also attacks of pneumonia. And generally, these are people who should receive vaccinations against COVID, against influenza, against pneumonia, so that it protects them from very severe forms.
Okay. Thank you, Dr. Magana. We have to go for a quick break. This conversation continues after this break, but don't go too far because Dr. Elizabeth Onyango, Dr. Daniel Ndwiga, Dr. Lois Wagana, and Maurice Adwar from Novartis are staying with me.
Get the best value for your money by subscribing today for Classic Bouquet at only 899 shillings for 30 days to enjoy 64 channels. Classic Bouquet. Premium content on Star Times. Subscribe today.
The Age magazine, found in the Business Daily every quarter, shall be published on the 30th of September 2021. Agribusiness and sustainable food systems, how investors are showing a healthy appetite for the food sector, technology's role in sustainable farming, and the growing effects of private capital and agri-foods farms. To advertise on this magazine, contact Alex on 0723 223 266 or email theage@ke.nationmedia.com. Grab your copy of the Business Daily or subscribe to the e-paper at epaper.nationmedia.com. Business Daily. More possibilities.
Get ready. Selfish, 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 selfish. Shake your waist. I think cats are more better than dogs.
Dogs are better because they also protect us and also they are also friendly.
Look at you, Uncle Casey, so cute.
I'm so red.
How big is he gonna get?
That depends, doesn't it?
On what?
On how much you love him.
Are you ready?
Wonderful, your baby's quite active.
After I discovered Molfix, I rediscovered my baby. She's jumping and running around.
Well, we call that the Molfix Comfort. Thanks to its elastic side bands, Molfix provides freedom of movement for your baby. All babies deserve a high-quality diaper. You should also try Molfix.
Fresh fried ginger has ginger oil, which is good for a healthy living lifestyle. It combines wonderfully on salads, stir-fries, when basted on roasted meat, or simply sprinkled on your favorite dish. Now available in 250 ml, 500 ml, and 1 liter.
ABSA congratulates Olympic champion Faith Kipyegon on winning the women 1,500 meters at the ABSA Kipkeino Classic.
Stand a chance to win 1 million Kenya shillings monthly grand prize by depositing into your personal or business account. 10 lucky winners will get to double their deposit of up to 100,000 Kenya shillings. The more you deposit, the higher your chances of winning. That's Africanacity. That's ABSA.
AMRC's objectives are aligned with the government's affordable housing pillar of the Big Four agenda. Visit any of the participating financial institutions today and start your home ownership journey. Kenya Mortgage Refinance Company, unlocking liquidity for affordable housing.
Thank you for staying with your world on NTV this morning. We want to resume our conversation. We are talking about, it's World Heart Day, of course. We are talking about the burden of heart diseases in Kenya. I'm still with Dr. Elizabeth Onyango joining us virtually this morning. Dr. Daniel Ndwiga with me in studio. Dr. Lois Wagana Murithi joining us virtually from Nyeri, as well as Michael Odwor from Novartis who's also in studio with me. But before we resume that discussion, we promised you that we did have a small chat with a patient who is actually battling a heart disease at this period, at this time of COVID-19, when of course incomes have been depressed, and she has a lot to talk to us about. Let's get to listen to her story. Esther Wahome.
My name is Esther Wanjiku Wahome. I'm a mother of 2. The heart condition started this year. That is in January when I was diagnosed. But I have a long way of dealing with health issues. So I believe maybe it was there before. It's only that it was not diagnosed. I had high blood pressure before. Come December I was in the hospital because of hypocalcemia, and I was discharged on 17th December. 25th, I started wheezing kabisa for around 3-4 days. And then I was taken to Avenue Nursing Home, Hospital here in Thika, and still wheezing very badly. So I was nebulized, and then I was told to have assessed an X-ray. The heart was quite enlarged, and they ruled out congestive cardiac disease, and they also ruled out COVID. I was to be admitted because of the how I was, and so I was admitted. I stayed there for around 2 weeks, now treating the congestive cardiac disease, actually to stabilize me. So I stayed there for 2 weeks. Then they requested I be done an echocardiogram. That is how we added to Nairobi West Hospital, where it was done. And that is when now it was confirmed that I actually have heart failure, because the heart was beating at 35%, yeah. Mine is cardiomegaly, so I'm on follow-up now. For the heart, I'm taking digoxin. I'm taking Conca, that is Bisopro. I'm taking Uperio. I'm taking Proclarin. I'm taking Adacton. And then this one I should not forget, because I'm also taking because of the heart when I become so breathless. This is an inhaler. Some of them I buy Others I get from the hospital. In the hospital, I use insurance, NHIF, but the rest I buy from my pocket. Before I went to Nairobi Hospital, when I went to Muruba for admission, nasikia kulikuwa na COVID test. Kawaida mtu akiona you are ruled out COVID, everybody is scared. Even the health, the health staff, healthcare staffs, they are scared even to face you. Yeah, but I was given the first dose of Moderna last Monday. The first vaccinations I didn't have because my BP could go quite down. I remember when they called me to have the vaccine, my BP was 80/40 for consecutively for some days. The general public, I would advise them always to seek medical care when they have an issue. I would like the public to know it is always good to take medication the right way, how you are instructed by your doctor. Take it at the right time, and you take them religiously. Then, on follow-up, keep a record, and be prompt when you are doing the follow-ups in the clinic. Never fail, because I've seen that has helped me a lot, because I never fail for my clinics. And again, you need to have a support team, somebody that, like here, I have Faith. When I feel bad, she's there for me. I have the healthcare team whom I always call when I have an issue, and they are always ready to listen to me and advise me accordingly. With a heart condition, you have to be very careful on what you are eating. Don't overeat. It is good to eat kidogo kidogo, frequently, because if you overeat, you'll make the heart to overwork, and then always to avoid stress. Stress endangers the heart disease. I'm going to take this.
Esther Wahome, a patient that we spoke to on how, of course, battled with the condition that she's suffering from, especially during this period of COVID-19, and it's clearly a struggle. Dr. Magana, from where you sit, there are definitely other people like Esther who are watching this show this morning. What would you have to say to them?
Yeah, I would like to just repeat something that Esther has said, and I really thank her for saying that. Concerning medication, it's very, very important that we take our medication faithfully and without interruption. Sometimes we may give someone medication for heart failure just like any other medication, and we feel like they are feeling worse. It's important that if that should happen, that we should go back to the doctor and raise our concern as opposed to interrupting. Because sometimes we start someone on medicine, we start on the path to recovery, they feel better, they think these medicines are too many, they reduce them or stop them and get worse. And it's much more difficult to get to the same point of improvement. Sometimes we've actually lost the chances. So continually taking our medication, going to the clinic on time. If you find for some reason the appointment, you cannot meet the appointment, it's important to ensure that there is no interruption of the medicine until the point when you're able to see your doctor. If you find that you're not getting better, rather than stop the medicine, perhaps seek a second opinion so that the recovery is not interrupted. Fortunately, now we have some very good medication for heart failure. Esther mentioned some of them that she's on. Unfortunately, they are still a bit expensive, and maybe an appeal to our government to consider subsidizing some of these drugs, especially a medication like Ethereal, which is quite costly, but it's changing the course of heart failure, and we are seeing a lot of improvement in that. we also need to, we'd like to appeal to patients, especially with heart failure, to get the COVID vaccine. The reason why we appeal for this is because the COVID vaccine prevents severe forms of disease. It doesn't completely protect from COVID, but people who get COVID when they have been vaccinated are not getting severe forms of disease. So that's a very humble appeal, because it will make a difference in terms of the outcome, not just survival from that very acute disease, but even post-COVID recovery is much better for people who have been vaccinated.
Okay. Dr. Magana, on the same issue of COVID-19 vaccination, you're definitely aware that across the world there's always been a concern about the side effects of these vaccines. There's been unproven allegations or concerns that some of them could cause clotting, and this is something that, of course, is a major concern for people with these heart conditions.
Yes, if that is correct, and any medication, including Panadol, has a potential to cause side effects. But we don't fail to use the medicine because of the fear of the side effects. We look, on one hand, what are the risks of this intervention or this medication or this vaccine? On the other hand, what are the risks or the harms of what it is protecting you? So generally, the rate of severe effects or side effects of COVID vaccine is 1 in 100,000. If you look at all forms of complications of COVID vaccine, if you look in a general perspective. So if 100,000 people receive the vaccine, we expect that 1 out of those is likely to get a severe form of side effect. However, if 100,000 people get infected with COVID vaccine, we know that the risk of severe disease is about 20%. So 20,000 out of those will require to be either on a lot of medication or even hospital.
Okay.
We know that about 3% of people will die from COVID infection. So out of the 100,000 people who get COVID, we expect about 3,000 people will succumb to the disease. They will be killed by the disease. So by any measure, it is better to be exposed to the risk, potential risk of 1 in 100,000 than the potential risk of 1 in 20,000 out of 100,000. So we are not able to say that if you get a vaccine, 100% you will not get a side effect. But what we are saying is that the risk of the vaccine is much, much lower than the risk of exposure to the disease. And that is just the acute disease. We're not talking about the other long-term effects of COVID, which have not yet been studied.
Okay.
So there was also the question about clotting. That's a question that comes across a lot, because especially with the AstraZeneca vaccine, there were those concerns. But I think one of the more robust evidences is from a study in Germany, where we see about 4,000 out of 28 million people got issues with clots.
Okay.
And the clots that came out of the COVID vaccine is a specific type of reaction to a drug that we use a lot in preventing bleeding. It's called heparin. So it's called heparin-induced thrombocytopenia. This is a genetic defect that is extremely rare.
Okay.
So if you look at 28 million people, if you look at a risk of 20%, we're talking about a huge number of people, 280,000 who will get this disease. So yes, there's a possibility of thrombosis or clot disease, but it's not, it is extremely rare compared to the risk of COVID disease.
Okay. Thank you, Dr. Magana. And Michael, if I can come back to you then. Clearly, you said 6 years ago when you came, there was still an issue of data of how many people are suffering from this and much more. If you look at the situation right now, there's still a lot that needs to be done in the industry. Just talk to us about that as we begin to wrap up this conversation.
Thank you very much. So just quickly, as I mentioned, we run a lot of programs in partnerships. And as usual with all the pharma companies, we work through the doctors, the healthcare professionals. So in regard to the question you asked regarding data, last year we partnered with Kenya Cardiac Society and again with the support of the Ministry of Health to try and create or come up with the first ever database, call it Heart Registry. So this is a registry that will have information regarding the demographics of heart failure patients across the country. so that at a click of a button, you can be able to tell what is the proportion, for example, between the genders. How many males versus females would be suffering from heart failure? And where do these patients predominantly live? Do they live in the urban areas? Do they live in the rural areas?
Yeah.
So the program just started last year. It is still ongoing. It will be going on for a few more years.
Yeah.
And at the end of the day, the idea is to have a database that can inform policy. Tomorrow, if the government, and Dr. Nyango is here, want to create a policy around heart failure, there is some data that they can depend on. Yes, and Novartis is happy to partner with Kenya Cardiac Society and Ministry of Health to try and support this so that it can inform future policy decisions.
Okay. Dr. Ndwige, I'd like to come back to you on the issue of prevention, but before I do, allow Dr. Onyango to briefly respond to, of course, what Michael has mentioned in terms of the importance of partnership and perhaps what she wants to see more in the industry going forward. Dr. Onyango.
Okay. Yes. Thank you. For partnership, as I mentioned, we are open to partnership as Ministry of Health. In fact, that is one of the strategies that we are adopting so that we can address these cardiovascular diseases. And the issue of registry, that is good. And we are also encouraging adoption of technology, which most of our partners, some of our partners are really good at, and we will endeavor to adopt that. And as he has also mentioned, we in the Ministry of Health, we have also developed a cardiovascular disease guideline that will also, guide our health providers at different levels, that is at the dispensaries and even the community levels and even higher levels, on how to provide the services. But we need to know, as he has said, who are we providing these services to? And so registry will inform the decision making. And so we are open to that partnership, yes.
All right. Thank you, Dr. Onyango. Now, do you, Dr. Ndwige, as we wrap up this conversation, there's definitely someone who's watching this. They've seen the pain that Esther is going through, and they're wondering, how can I perhaps protect myself, if there's any way of perhaps preventing or protecting yourself from perhaps getting these diseases?
Yes, I would actually summarize it for you to be able to work at it in terms of 3 major points. One is keep your numbers. The numbers here are your body mass index. That is your weight divided by the square of your height.
I should write them down,
Yeah, that should be below 24. So that's a body mass index. That's a number. We want it to be at 24, which is your weight divided by the square of your height. 24. You can do that for you in any health facility. We'll be able to help you with that. Your blood pressure should really be below 140/90. If you can get it below 130/80, we'll be very happy with that. Your blood sugar should be below 11.1. So those are 3 important numbers you need to look into.
I missed one. It's body mass index, blood sugar, and
body mass index below 25, blood sugar 11.1 and less, and your blood pressure 130/90 and below. So keep your numbers. It's very important. Number 2 is clean your lifestyle. We would like to encourage you to stop smoking, please. There is no benefit of smoking except to the manufacturer and to the seller. As regards the population, there is no benefit of smoking. Reduce your alcohol intake. We suggest that you take 1 or 2 standard drinks in a sitting, no more than that. And that would probably be just 1 bottle of Tusker. I know KBL may not be big fans of mine, but 1 bottle of our Tusker 500 ml is more than sufficient for that one sitting. 1 glass of wine, 1 tot of whiskey, but not more than that. Nothing more than that in a sitting is allowed really for your sake. Don't add salt to your diet. And then exercise. We suggest that you pant and sweat 30 minutes most days in the week. Or if you want to, you can say 150 minutes a week of exercise. This means that you pant and sweat. Notice I didn't mention the gym. I just want you to pant and sweat for 150 minutes a week. You're safe. And lastly, we accept you to, having done those 2, to actually watch your lifestyle. In terms of sleep, you need to rest. In terms of stress management, you need to manage your stress. In terms of socialization, don't work. It's not an issue of all work and no play. It's actually your health we're talking about here. So make some time to be able to rest, make some time to be able to relax, and develop some hobbies. And then finally, we want you to actually make an appointment with your doctor. If you're over the age of 50, suggest once every 2 years. If there are any alarms, if your blood pressure is an alarm, if your cholesterol is an alarm, your sugar is an alarm, please make sure it's followed up 6 months later with an assessment of the measures you actually put in to be able to help yourself stay well. So watch your numbers, clean your lifestyle, and then see your doctor. And you should be able to stay free from heart disease.
All right. Thank you very much, Daktari. And before we wrap this conversation, definitely let me give each one of you 30 seconds to wrap, to give us your parting shot. I'll start with you, Dr. Magano, strictly 30 seconds.
Thank you, Chief. Remember, again, ensure that we take our medication without interruptions. We discuss our concerns about side effects with the doctors, and a kind and humble request that we get vaccinated. COVID vaccines are important for all people with heart disease, but also flu vaccines once a year and pneumonia vaccines. Thank you very much.
All right. Dr. Onyango, 30 seconds for your closing remarks.
For us, let's all join hands together to halt the rising cases of cardiovascular diseases. We advocate early screening, early detection, early management, eat well, exercise frequently, avoid alcohol, avoid tobacco. Know your numbers, as Daktari has said. Thank you.
All right. Thank you, Dr. Onyango, and maybe to you, Dr. Ndwiga, your parting shot.
Thank you so much. Once again, I'll echo the sentiments expressed by Dr. Wagana in terms of COVID vaccination. We encourage everybody, really. If you're over the age of 40, please get vaccinated, and especially if you have heart disease. That's really important. Yes, there are risk factors, but as she mentioned, even drinking water has a risk to it. Yeah. So will you say don't drink water? We'll say please get vaccinated, because we know that it protects you more than puts you at harm. And lastly, the drugs that our patient had mentioned there, on average in this country are mostly available in the private sector, a bit in Kenyatta I would believe, but the cost would be between 7,000 and 15,000 shillings. We need the government's intervention in this, because that's like somebody or a whole family's salary just because of the health of one person.
All right. Michael, I think this is a good place to give us your parting shot.
Yes, so in addition to what the doctors have said, from Novartis, we believe in partnerships. So number 1 is partnership, number 2 is partnership, number 3 is partnership. And we do this through 3 key pillars. 1 is to broaden access, to expand access to all the patients in the country. And number 2, through capacity building. So if there is any capacity building program, Novartis would be happy to be a part of it. And lastly, by also contributing efforts towards strengthening the health systems in Kenya and in sub-Saharan Africa.
All right. Thank you very much. 3 minutes to the top of the hour on this 29th day of the month of September, which is also the World Heart Day. That's where we leave this discussion about the burden of heart diseases in Kenya as we celebrate the World Heart Day. Many thanks to my guests this morning who have helped us dissect this conversation. In studio with me, of course, Michael Odwor is a franchise head for cardio, renal and metabolic franchise for East Africa and Novartis. Also in studio with me this morning, Daniel Ndwiga. Dr. Daniel Ndwiga is a board-certified physician, cardiologist, and electrophysiologist, who is also a member of the Kenya Cardiac Society, as well as joining us virtually this morning, Dr. Elizabeth Onyango, public health specialist and the head of the Division of Non-Communicable Diseases and Prevention and Control at the Ministry of Health, as well as Dr. Lois Wagana, who is a physician and cardiologist, of course, joining us virtually this morning. That's where we leave it. From me and the entire team led by our director, Arnold, it's goodbye for now, and God bless.